Antipsychotics are essential for managing psychotic disorders, along with other treatment strategies such as family intervention, cognitive behavioral therapy, case management, and addiction treatment if necessary. The weight of evidence suggests that long-acting injectable antipsychotics, or LAIs, are as effective as orals and in many cases may improve the rate of remission. There are a number of specific benefits to patients from LAI antipsychotics. These include practical benefits, where a monthly injection means patients and their families do not have to worry about remembering to take the medication on a daily basis. As well, LAIs offer early warning of noncompliance. If a patient becomes noncompliant, the clinical teams will learn of this quickly and be able to respond. Regular injections also offer an opportunity for increased, ongoing patient support, as patients are seen by the healthcare team at regular intervals. This provides opportunities for increased formal psychosocial support, for example, treatments through life skills programs. LAIs also provide possible dosing advantages. As LAIs bypass metabolism during the first passage through the GI system and the liver, the plasma levels of active agents are predictable and more stable than oral formulations. With LAIs, it can be easier to find the minimum effective dose and possibly reduce the frequency of side effects. With injections, nurses are better able to detect relevant clinical changes. Overall, LAIs can decrease the risk of relapse and hospitalization, reduce disengagement from services, and lower other health and social consequences that stem from inadequate treatment. Yet, despite this evidence, long-acting injectable antipsychotics are underused in Canada compared to the rest of the world and are subject to significant national disparities. The reasons are complex, but include limited knowledge and experience with LAIs, bias against needles, a reluctance to prescribe LAIs in the early phases of psychotic disorders, and, most importantly, a perception of LAIs as a last resort option for patients with a history of non-adherence. To help counter this, clinical recommendations on the use of LAIs were recently published. The recommendations highlight that LAIs can have an important role to play in the recovery of individuals with schizophrenia and should be more broadly included in treatment plan discussions with patients and their families, early and often. While there are 10 recommendations for Canadian clinicians, I would like to highlight that LAIs should be discussed as a treatment option with patients and families at all phases of the illness and on a regular basis. Patients' attitudes towards their illness and treatment can change during their engagement with the treatment team. Information about LAIs should be part of an informed patient decision. Psychiatrists, mental health nurses, and other mental health clinicians should be well informed and trained in the use of LAIs. Clinicians should be aware of any potential personal biases about LAIs and feel comfortable discussing them and attempt to correct them, as it is in the best interest of their patients. If LAIs are initiated in an acute care setting in an involuntary way, it is important to discuss the reasons for introducing this treatment and the importance of maintaining the LAI, in addition to reviewing the potential side effects with the patient. This allows the patient to express their views and address any possible negative associations with LAI treatment. With schizophrenia, non- and partial adherence to antipsychotics is a major barrier to improving outcomes. So when non- and partial adherence is an issue, serious consideration should be given to using LAIs. The Quebec Association of Psychiatrists Consensus Committee created the Quebec long-acting antipsychotic algorithm. This algorithm suggests that atypical LAIs can even be proposed as a first-line pharmacotherapy option after evidence of a first psychotic episode. Considering the frequency of treatment noncompliance and high risk of relapse, the algorithm goes on to suggest that LAIs should be used in 15 to 25% of patients with schizophrenia under psychiatric treatment. Overall, considering the frequency of treatment noncompliance and the high risk of relapse and secondary deterioration, the low use of LAIs in Canada needs to be better understood and addressed from the patient and clinician perspectives.